Welcome to Raising the Bar, the podcast that pulls back the curtain on the country's most successful leaders and how they elevate their business and their teams. Please welcome our host, Alison DePauli.
Welcome to the newest episode of Raising the Bar Live, where we talk about all things raising the bar in your benefits. And today I have a remarkable woman who owns a remarkable business called Next Level and Next Level Prime. And I'm going to let her tell you what all it is. But Dr. Breeze, thank you for joining us.
Thank you so much for allowing me to be here, Allison. I am very honored to be a friend of Allison's. So
back at you.
I am especially excited because this happens to be my favorite topic. I absolutely love talking about what we're doing in healthcare. I am a primary care doctor by background, but took a circuitous route to get to where I am today and have been in the business of medicine, running orthopedic practices, running surgery centers, and doing a lot of businessy healthcare things until I landed at starting Next Level. And so anyway, I'm excited to tell you about Next Level because Next Level has sort of has had this incredible evolution. And so that's why we're here today, I guess.
So I'm going to share a quick story about how I first met you. So we were connected by Dr. D, who knows everybody. And she said, one of my friends, she does this thing and she's looking to expand into San Antonio, and anybody you can connect her to. And I have a friend and a business mentor who used to own urgent care facilities in San Antonio. So I connected the two of you, and you had quite the afternoon driving around San Antonio looking for locations. And you found a few more than I had thought. And when I heard what Next Level was, I did one of those head snap things. What? And I thought it was absolutely fantastic. And you are remarkably successful in Houston, and you have expanded to San Antonio, and you've gotten some fast traction. Like, people are like, wait, what? I want that. And I think that is terrific. And, but Next Level started as one thing and it has expanded into something else. Will you tell us a little bit about that?
Yeah. So when I first started Next Level, it was honestly an opportunity to address cost and access in healthcare, which are two, if you are in healthcare, those are pretty big problems that we have across our industry. I had a personal experience of having to drag a child into an ER on a Saturday afternoon when there was absolutely no reason for us to be in an ER, but there were no doctor's offices open. My pediatrician was closed. And so it got me thinking, Houston needed more places where people could go after hours and on the weekends, because like me, a lot of people work and they just can't get their health care in during the work week. And so the original idea was just to provide, and by the way, the other big problem with that whole experience was the cost. It was an insane cost for a very minor issue. And I just felt like, I know how to do this. I can put up these urgent care centers that will address acute needs and will be open these odd hours and will be far less expensive than going to an emergency room. So that's what we did. And it was a great idea. It took a bit of time to catch on, but it ultimately, we got to be very successful as an urgent care company in Houston. But what you're talking about and this evolution that happened basically around right before COVID started. We started getting this idea in our head that this is great and all because we are addressing a problem, cost and access. But there is another problem that's brewing, and it only got worse during COVID, but it was already starting pre-COVID, which was that people, and you can probably tell people more about this than anyone, because of the high deductibles and the way that employers were approaching healthcare benefits and trying to keep the costs in check because employers will get presented with higher premiums every year. So in
Yep.
order to keep the costs in check, they started doing things like really narrowing networks
Raising
and
the deductible.
really elevating deductibles. And what was happening was patients were basically getting squeezed out of healthcare. So
Mhm.
they weren't getting their primary care and they weren't having the opportunity to address real concerns early. They were just like they felt okay. And so I'm just not going to go to the doctor because I can't get in. And even if I can get in, it's so much money. I don't want to spend the money. And so that was the problem that we then kind of focused on. And that was what led to launching what we call Next Level Prime.
I'm going to give just two quick examples, if I may.
Yes.
I know a lot of employers think it's if it's 50 or 80 or $100 to go to the doctor, or they have a plan that has deductible first and a member has to pay that, well, that's okay, because if
Mhm.
something big happens, then we cover a large amount. And I have a client that has a $2,000 100% plan.
Right.
I think it's fabulous. It is very difficult for people to navigate. We help people quite a lot when we have those plans navigate, because people are terrified to go to the doctor. They
That's right.
don't know what it's going to cost. They don't know what they're going to be told. They don't know what's going to happen when they go to the pharmacy to pick up their medications. So having something where you can get your basic care done at a known cost is incredibly effective. And it is the, gee, I think I have strep throat
Yep.
and I'm going to call and pop over for a test. It is a, oh, I'm a grown woman and I've lost my voice for the 72nd time in my life, and I know I need X. Let me call and get X.
Mhm.
Or it's the, I just fell in the closet, which recently I had an experience with, and I could go to the urgent care and maybe not the emergency room. And the cost differential is like a factor of 10.
Yeah.
And as an employer, that is concerning, but as a member, it's concerning too.
Absolutely. Absolutely. And I think what happens is so I straddle a very I am both an employer and also a provider of care.
Mhm.
And so I can see the issue from both sides. As an employer, I want my employees to be healthy. I do not believe that there's an employer out there that is saying, I don't care about the health of my employees. Actually, when you when you run a company, you want your staff members to be well taken care of. I mean, I just truly believe that that's
I do too.
underlying. That's the attitude of employers. The problem is that, like you were just saying, a lot of people don't know how to get there because, for example, we have a client that is a wonderful employer. None of their employees were using healthcare. They were not going for annual physicals. They were not going in for their routine screenings. They had no idea whether they had any early issues or even late issues because they literally were not going. Why? Because the employer was giving them healthcare, but that was a manufacturer. They didn't have any disposable income to spend on a doctor's visit. And so, when we were looking at these kind of issues, we that's why we chose to make ours actually a zero pay for employees. So our employees on our program do not pay for anything that they receive at Next Level, be that a lab or a preventive screening or a, urgent care or whatever.
And you do basic imaging as well,
We
correct?
do. We do x-rays. Yeah, we do. We do it all. So, I think the thing is that we were already good at urgent care, and then we expanded to do this advanced primary care, which, by the way, isn't just the doctor's office stuff. We do mental health care.
Yep.
We have counselors. We have health coaches that help people with lifestyle changes. We have care navigators who help people just navigate the very difficult healthcare system. So we have tried to look at what is wrong in healthcare and how
Absolutely.
can we fix it? And so we've put together a team that approaches people in a holistic manner to take better care of them. And we've removed the obstacles. So we've removed the cost barrier and we've removed the access barrier by giving them these additional 44 additional hours a week that we're open in person versus any other practice out there.
And you are also a very large proponent of an annual physical. And
Very
that
large
can
proponent,
be
yes.
a challenge for people to, one, to get scheduled, and two, you got to do the labs, and then you got to do your appointment. And talk a little bit about how that process works.
Yeah, we redesigned the annual physical because honestly, I think I take a lot of my own life experiences and I say, I really didn't like this. So let me see what I could do better. I personally do not like getting into a gown, having my butt hanging out, waiting for a doctor to interview me when the exam room is cold. And I'm trying to tell them about, important things about my health history, but I feel exposed and uncomfortable. So what we decided to do was change that first part of the annual physical to be from home. So, or from your place of comfort. That might be your
Wherever
car
that
or
is.
your office or the street. It doesn't matter. It's a virtual appointment that we spend 30 minutes face to face, just talking to people about, your family history, your social history, what's going on in your life. How are you feeling? How is your marriage? How are things? How are you as a person? Because that's very important to your entire health picture. So we take care of that in a comfortable environment. And then we say, I call it the oil change. We send people in for a very brief full physical exam and lab work. And that can be done any day of the week. It can be done on a Sunday. It can be done, Thursday evening, whenever you have time. It's generally about 30 minutes also. And then we follow up when the lab results are ready with another virtual appointment, which is sort of the closing. So it's a 3-part annual physical, but only one part that's very quick is done in the office and the rest is done at your convenience from your place of comfort.
And you are open from 8 a.m. to 8 p.m. or you open
9 a.m. to 9 p.m.
Okay,
in person.
9 a.m. to 9 p.m.
But we actually also have 9 p.m. to 9 a.m. We are covered with telemedicine. So you can always get someone if you have a membership.
I want to point out something about the telemedicine. So I'm not a healthcare provider, but I spend a lot of time in health plans and I see a lot of claims. Yeah. And telemedicine is very convenient for people, right? I call, I get my thing, whatever my thing is. Yes. But with you, your providers with Next Level, your providers are answering the telephone. So one, on the off chance you may get somebody that you've spoken to before, but your information is in your medical record in your building so that when you go for your follow-up, I don't have to remember that I called telehealth because of whatever. Right. You see it. Your doctors see it.
So there's a couple points I want to make on that. First of all, it is not just if you happen to get your provider, because actually when you schedule a virtual appointment with us, you can see pictures and bios of all the providers.
Yes.
And you can actually schedule with the people you like. So you can always have who you want, depending on how flexible you are. If you have to be seen on a particular day and that person's not working, we have a whole team. So you can do that. But the other point that I want to make is that unlike Teladoc or some of these other services, when we're talking to you, like you and I are talking, and maybe you're telling me that you are starting to feel really bad. Maybe you have COVID or some other problem that everybody has these days. And I start listening to you and you sound like you're rattling when you're coughing. And I'm worried that maybe you have pneumonia. I'm going to say, Allison, can we put this video chat on hold? I'm going to have you drive over to the nearest location. And when you get there, just let them know that you are there to complete your visit, and they will take the visit off hold. All of the information that you've already told me is in there. And all you're going to go over there and do is get a chest x-ray. And then the provider who's there will finish off and make sure that you're well taken care of. Right now in telemedicine, there's kind of a black hole that happens. Yep. If a person is is not the right fit for telemedicine, they have to start everything all over again. And that just doesn't make sense to me. The other thing I want to say about telemedicine is I personally think that, the one thing COVID did for us is it allowed us to get really comfortable doing what we're doing today. However, there are certain things that I can't do while we are on this chat, including doing your pap smear or, doing a prostate exam for somebody, or even just touching your belly and making sure that you don't have an appendicitis. There are things that a physical exam still does for us. I'm old school. I believe in physical exams. And that's why I think that the integrated approach is very helpful, because you not only have your virtual, care, but you also have that opportunity to use the diagnostics, the x-rays, and the physical in the clinic.
And the diagnostics, you don't come and make one facility. You come and you open 8 facilities, right? So there are facilities all over town, right? And you're not tied to the same facility. You can go wherever you want. If there's one 3 minutes from your house or 3 minutes from your office, most people are going to end up there, right? But you can go where it's convenient. You're out and about, and somebody falls down and cuts a lip, then you just go to the next one. So I think the concept is remarkable.
Thank you.
I really do. And I think, I'm a user of care. I also have the patience of a flea, and to have to do a telehealth and then go to the emergency room, I'm just not gonna. And I think I might have a problem with my patients, but I don't think I'm alone in that. I'm not doing this again, and I'm not waiting 2 hours in the emergency room or 5 minutes, and it's cold.
Well, Allison, then let me I know you got a chance to see this, but you and we speak the same language. I have absolutely no patience also, and I don't really love going to the doctor. So I created, like I said, I solved my own problems, right? So we put together some tech, and the tech is a mobile application. And on the mobile app, there is a section for our members. And it's only for members. So if you go on our app, you won't see it if you aren't a member. But if you are a member, you can go to Can I Skip a Visit? Can I Skip a Visit allows me, I'm just going to give you the scenario of where I was, back about 10 years ago. I've got 4 kids. One of them comes home and they have pink eye. And I know I'm a mom, and I also have eyes, and I can see they have pink eye, and there's no earthly reason why a doctor needs to see you for that diagnosis, because you really, most people can diagnose themselves. So you could get on Can I Skip a Visit? And you are basically taken through an algorithm of questions that make sure that we are not dealing with something more serious. So, it asks a lot of questions related to, are there other diseases happening? Are you a contact lens wearer? Are there, so after we get through all of those things, if the algorithm spits out, yep, this is consistent with pink eye, then you can skip your visit, and we just send a prescription in, and you don't have to load all 4 kids into the car, take them over to the clinic, spend your evening in the clinic because they, got home from school and the doctor was already closed. So those are the kind of things that we've built into this program to try to address the simple problems that people have every day with accessing healthcare.
And those are reviewed by a doctor before they
are.
Okay.
Yeah. So we're not just putting it out there, but the doctor gets to see, okay, these are the
whole
answers,
thing.
the medications that they're on, the allergies that they're taking. So really, it's kind of like what we would do if we interview you on a virtual visit, but you don't even have to be on a virtual visit. You could be doing it from your car on the way home. Don't do that. Actually, you should be driving, but you could do it from anywhere. Yeah, as you could stop and do it. Yeah, exactly.
And so you also do a lot of work with school districts. And those, teachers cannot run out in the middle of the day. They can't. So that's an early morning or a late evening kind of thing. So you do a lot of work with school districts, but you also do a lot of work with private employers as well. Yeah. Tell us some results from that and how that model has evolved.
So, Allison, I am just living my best life right now, because sometimes you feel like you have a good idea and then you put it out there and it just doesn't do exactly what you were hoping. But this one actually is working. So I'm super pleased with how things are going. We have been, this is a fairly new program. We only started in 21. We had our, right now we have about 135 organizations. We actually had more, but a couple of them coalesced. So now we have less organizations, but we have not lost anybody. In fact, over this summer, we had all of our clients that were scheduled to renew, it's a 1-year contract. All of them have renewed. So that's very exciting because it really goes to the point, of, are we delivering something that people appreciate? And there's 2 ways that they appreciate it. One is on savings. And for example, if you've checked our LinkedIn lately, we had a client testimonial that was probably the best one we'll ever get, that they think we've saved them about $12 million in 2 years. Of course, that's a huge employer. It's a county. We had about 4,000 members on that plan. And so that one was a big win, but every single one of our clients has demonstrated savings to some extent with our program. But the other side of it is employee retention. Loss or decline in lost days from work because they don't no longer have to leave work. They can go on a weekend. They can go in an evening.
Yep.
So there's a lot of things that employers are finding work for them about this program, and not the least of which is labor competitiveness in the market. Because when you are out there as an employer saying, hey, basic healthcare is entirely free to my employees, including lab, including mental health, including, that's something that not very many employers yet are saying. And so there's a real advantage to that. Myself, we've seen employee retention dramatically improve after putting Prime in. Our business has also saved a lot of money doing Prime. So it's been a benefit for my own employees as well as, as others.
So next level is the urgent care component, and next level Prime is the urgent care and the virtual primary care.
We call it advanced primary care because it's that comprehensive thing. Yep. But yes, next level Prime is the membership. And by the way, our people who are watching may be like, oh yeah, that sounds great, but it's probably costs an arm and a leg. And it does not. So if you are an employer that is under 100 employees, it's $75 per employee for the employee and their family per month. And if it's over 100, then it's $60 per employee per month for the employee and their family. So if you think about that, like an employee, if it's just an employee and their spouse, then they're paying $1 a day for each person to have unlimited access to 24/7 healthcare that includes all of these services, and they pay nothing themselves.
Huge. I was at I just helped one of my clients put in an on-site clinic, and they're small for an on-site clinic. And that was a very pleasurable challenge. Let's say that.
Yeah.
And so that's good. And that's working. And I was visiting with another client of mine, and he was like, I've known him for a long time. And he said, so what's new in your world? And I'm insane about this clinic. I mean, I'm just like, so I'm like, we did this. And he looked at me. He has about 15 employees and said, I want that. I want that. How do we do that? I bet we can't do that. I bet it's too expensive. I said, you don't have an extra office and you can't pay an MD to sit here for 40 hours, but we can get really close to that.
Yeah.
And then it was like, it costs what?
Yeah.
So
we got the idea. Yeah. I mean, how we started was because we were providing on-site care for a big employer, and we were seeing, gosh, patients love this. They love free. They love free, and they're very compliant when they're in that environment. And guess what? You know what? Who else loves it? The people working at the clinic. My employees love not having to ask people for money, not having to check their insurance. That is
having to change the drugs.
That's what we brought from Prime. When we started Prime, we said, what are the best elements of an on-site? And clearly not every employer can afford an on-site, but gosh, we can actually, and now what's interesting is that we have employers that have on-sites that are now adding Prime,
Yep.
because on-site will allow them to have that access for their employees during the workday, but their families don't really love coming into the workplace to get care.
Yep.
And the even the employees have issues that arise after hours and on the weekends. So if you also have a large employee group, not everybody is convenient to one location.
Correct.
So like, in San Antonio, where we have 8, or Austin, we have 7, and now in Houston, we have 26. So there's a lot of opportunity for people to get, and we're hoping that we build out those other regions just like Houston, because there's a lot of need for something like this, a very convenient, affordable place to get care whenever you need it.
I want to go back and frame that pricing a little bit. So a typical urgent care visit will be $250. And let's say you have a lot of people with children on the plan.
You're going to
be one per member.
Mm-hmm.
You have already more than paid the cost for a whole host of other things.
That's right.
And 24-hour a day care. Okay, the facilities are not open after 9, but most people don't need a whole lot after 9. And if you need something at 2 a.m, you might need to go to the emergency room. But I just think that's remarkable and so helpful for people. And I think the average wait time for a physician visit now is 26 days. So I joke that either you're cured or you're dead.
Right.
Right. And that may be too harsh, but most people can't wait 26 days. So they go to the urgent care. But the reality is primary care can address almost anything that happens in urgent care. Correct?
That is totally true. And the thing is that, so with our membership, we offer we're guaranteed within 24 hours, you will be seen if you need to be seen for anything, whether it's primary or urgent, preventive. And so this is something that I think people deserve. I mean, you can't time your illnesses and your need for a doctor to line up with the 26-day wait. That's just ridiculous. Yeah. And so we have to find a better way. And this is what I'm hoping is that our model catches on. And a lot of people say, well, it sounds good, but it sounds a little bit too good to be true. And how are you doing that? How can it be that inexpensive? And honestly, I mean, part of it is that we are not, we're not going through insurance. So the employers send us a list of their employees and they pay off that list. And we know we're going to get that money every month. And so that's sort of taken care of for us. That eliminates an entire billing department that I have to put in place to send claims out and get rejections and work denials and all of this stuff. It's crazy what we've done in our healthcare system in order to get paid in this fee-for-service world. So I really believe in the value-based model. I believe in paying a contracted rate and just having access to a bevy of services. And so that's what we're doing right now.
I want to have a maybe brief philosophical discussion about a PPO discount or a cash pay price. I hear an awful lot that, well, the PPO discount is the best price and I need a card because I need to know where to go. Shake your head a little louder. I just think that healthcare is not necessarily all that expensive. If you need a heart transplant or you've just had a heart attack, that's something different, right?
That's expensive.
You've just been run over by a bus, that's something different. Yeah. But I have strep throat, I have a UTI, my kid fell and broke his arm.
Yeah.
None of those things are expensive to do until you put 5 middlemen in the middle.
Exactly. That's 100% correct. And by the way, so I mean, just to clarify, because I don't want people to get the wrong impression, I believe in having health insurance.
Yes.
And we pair our program with health insurance because people get in car accidents and people get terrible cancers and people have preemie babies. That is not something Next Level can do. Correct. What we are doing is simply controlling the 90% of what people generally access healthcare for during the year. And then those outliers, you should have insurance, but I always liken it to, we don't buy insurance for oil changes. We
Or
buy
car
insurance for car crashes. And
correct.
so this is kind of what we're doing with this, with how we've made health insurance start at the very lowest levels. It's just made it more expensive, and there's
Mhm.
just no reason for it.
And
So
it's made it more expensive at every point.
at every point.
At the doctor's office,
Yep.
in the lab, at the imaging facility, in the emergency room, and in the hospital.
Yeah.
So when you can remove a lot of that, you eliminate a lot of the expense.
Yes. I
And
think the other way that we eliminate expense, and I think is very worthwhile for people to understand, is in the whole grand scheme of total cost of care, the major drivers right now are pharmaceuticals and advanced imaging and hospitalizations, right? So, people ask me, well, how can you help with that? Well, one thing we can do is we can ensure that we are keeping people on formulary for their medications, and we're keeping people in generics when possible. That we are following the rules of the plan as much as we can for instance, things like how people are approaching weight loss drugs and things like that. That's a big deal these days. So we get with our clients and we say, how do you want us to approach this? Because everybody has a little bit of a different spin on that.
yep,
Also, we are able to navigate patients to particular points of service that makes sense for the client. So the client can tell us, we really love Surgery Plus, and we want you to only send our surgeries there, or we use a cancer care
we use
add-on, and we want.
Prosper, we use whatever.
Yeah, I mean, so we have this navigation that helps employers to actually make those decisions that they've made on their plan actually work, because the patients get there. The biggest problem that employers have, not the biggest problem, we have a lot of problems, but one of the problems we have is that we have these great ideas and we put them in place and then no one uses them. And so
Because they don't know how.
they don't know
Or
how.
they're afraid. And that is a big deal.
That's right.
It is,
And employers are not the ones, like, I can put something in place for my employees, but if they go to a doctor who doesn't understand what I just put in place, that doctor is going to make their normal referral or tell them to go to,
where they know.
whatever radiology place they want them to go to. Now we've trained our employees to reach out to our care navigators for anything. So if they get told by a doctor that they need advanced imaging or that they need a surgery, hey, contact us and let us help you with that process.
I think that to me, that is always that has been the missing piece, is how you connect the patient to the structure you have created. Because I can do a zillion things, but if there isn't somebody to help navigate that, the patient doesn't know what to do. Because an open enrollment meeting in a 10-minute conversation, I don't care if there's an intranet, I don't care if there's a paper guide, I don't care if there's something that pops up on their phone every 5 minutes. It is not relevant until it's relevant. And to communicate, call us, is very different than, well, you call this 800 number and then you do this and then you do this thing over here and then
No, I mean, I think it's funny because I feel like I have my own lab because I have 880 employees,
Yep.
and they are very patient employees. They're fabulous people, because I'll get on and I'll say, hey guys, we're trying this new tech and I want to see, can you all jump on and use it and tell me what you think? And I get amazing feedback. And so
Incredibly important.
we're trying to make sure that we're putting something in place that actually works for as many people as we can. We're not going to hit everything, but we're trying.
I think that's remarkable. And I think it's, I interviewed Isaac Higgins from Family Hospital a couple of months ago, and he said the same thing. He said, I am an employer and I deliver healthcare.
Yeah.
He said, my people don't have any problem telling me what's wrong with what I've done.
That's right.
They tell me when they like it too.
Yeah.
But he said, no problem telling me what's not working. And I think that's a really big gift.
Yes. Yeah.
So you can adjust.
I think that, there's a lot of entrepreneurs out there who solve a problem, but then they have to go find somebody who can even vet that it's a solution that matters. And I do have a large group of people who were previously not using healthcare particularly intelligently, because of anything that was wrong with them, but it was just out there. It is impossible for all of us to understand where you go for anything. I mean,
Mhm.
we've got all these different options and it's very confusing. And so when we put this in place and we said, just push the orange button and let us help you. And it's made
It's
a huge
remarkable.
difference. Yeah, it's made a
Yeah,
huge difference.
huge difference. And I think one of the ways that primary care helps control costs is by reducing specialist visits, right? Because you can have a conversation
Yes.
and you can figure out you're not shoving somebody out the door in 8 or 16 minutes, depending on your practice.
Mhm.
And you're not just handing out prescriptions willy nilly. And there are some very expensive prescriptions that are very popular, and people walk in the door and say, I want that. Well, maybe they're not even a candidate for that.
That's
But
right.
if you don't have more than 5 minutes to talk about it, 8 times out of 10, you'll get your script. And that's really probably not helpful. Can you
That
talk
is,
a little bit about over prescribing?
yeah, I mean, one of the things that we are, well, so there's a lot of really interesting things that are happening with prescriptions in general. One of the things that it was the most fascinating thing that isn't really about overprescribing, but it just came to mind is that we put in a solution, and it's a pharmacy solution. It's PharmaPoint, and what they do is they match what prescriptions we've made with the patients to show us whether they actually filled them, and also whether they have filled gaps. So a patient might have filled it once but then didn't get the refill, or maybe waited a month before restarting the medicine. Well, stopping and starting medicines can
Not
be
good.
very harmful, actually, and depending on what the medicine is. And it has been fascinating to learn and understand what is actually happening. So we have had some patients who talk about specialist referrals. So this patient, we had determined, so one of our providers had determined that she needed a specialist. Well, we actually have a several layers that you have to go through in order to get a referral done. And it's not to be difficult. It's because the way that we have taught primary care doctors in this country, we usually teach them in large institutions, and they're taught by specialists, and they're generally taught, I do this. You send me
Do the
these
thing.
things when they get to this.
Yep.
Well, I mean, the truth is, there is no magic to treating hypertension, and there is no reason for a cardiologist until hypertension gets to a certain point. Same with diabetes. There's like
Mhm.
diabetes. There's a very there 100%. There are some people who need endocrinologists, but they need endocrinologists when they have failed the basic things that are the stepping stones that we basic therapeutics that we use in family practice. And so there's a lot of, like you said, when it's a fee for service model, and the doctor makes more if they see more people. Well, the way to see more people is to just basically refer everyone, because
Mhm.
a referral makes the patient think you did something.
Mhm.
And at the same time, you're able to blow through patients. Well, we don't have that model. We have taken away that. Our doctors get the 30 minutes, and so they can spend that 30 minutes however they want. And so in any case, with the pharmacy, what happened with that whole situation was that we had this patient. She was referred to an endocrinologist, but before she got there, we looked at her chart and we said, does this patient really need this endocrinology referral? And the first thing we did was look at the PharmaPoint, and we saw that the patient had not been filling her meds. Well, I mean, before she goes to the specialist and spends a bunch of money, maybe we should talk to her about why she's not taking the medicines. Is it a cost issue? Is it that they make her feel bad? Is it that she denies her diagnosis? I mean, there's a whole lot of things going on, but that has to be sorted out before she goes anywhere further. So those are the kind of things that it's exciting when you can realize that the model works to catch that kind of stuff.
And I think that's very satisfying also.
Yes.
You are actually delivering care, and you're not just sending people everywhere, and you're not paying 5 people to bill and follow up on that, because that's how you get paid. You
That's right.
have a model, your cost structure supports that model, and you can pivot as you need to.
That's right. And by the way, I don't mean to say that doctors are just,
No.
trying to make money and stuff. It's just that there is a lot of pressure for doctors
Yep.
to see a lot of patients. And that's difficult. In our urgent care, we move patients through, but patients actually expect and
For sure.
want us to
Yeah.
move them through. But when they're primary care, and that's why I love virtual for Prime as the starting place, and then the clinics just as a place where they get their physical things met, because I think that makes it more special and a little bit more sticky for a person who wants to develop a relationship with someone.
And I think that relationship is very important because I think a part of healthcare is, well, do you eat these green things called vegetables? And do you occasionally walk around the block? And do you
Yeah.
sleep? And
And are you depressed?
are you
And
depressed?
how's your sex life? And how's
Yes.
your marriage? I mean, honestly, those are things that are
All.
very impactful, and we don't have the time with
Mhm.
the way that we've set up our system. And I think that's a shame because I think that we miss some some opportunities to make people better.
I do too. And I think, particularly with diabetes, it's a really hard thing. Okay, the formula to treat it is very simple, right? Like we know what that is, but it's not just a medication thing. It is a lifestyle change, and there's
Yeah,
a family that's impacted by that
that's right.
lifestyle. And I think that often is a big challenge.
That's right.
And you can address that in primary care. And if you see that come into your urgent care facility, you know to have a conversation about that again.
Well, and the other thing, Allison, is that we have a team.
Mhm.
So it's not just the doctor with their limited time to do this. We have outreach with the care navigators. We have health coaches that can do their, visits, and we also have the mental health counseling. And we use the heck out of the
Huge.
mental health counseling because you know what? When you have a chronic disease, you could get depressed. It's not fun to have
No.
to deal with that. And so we try to help teach people some coping skills and some things that will help them as they're moving through their journey with whatever illness they're dealing with.
And I think that's huge. I think, a lot of mental health diagnoses can be addressed in a primary care setting.
Yes.
And again, you need a little time, and you need somebody that has a little bit of time to go through and say, well, this and that.
Yep.
And I just cannot I can't say that enough. And employers are really interested in this. They are interested. I don't have a client that says, well, I don't care, just do this thing. I don't.
Yeah. No, I think we're all of us are struggling and saying, well, how do we do this? How do
Mhm.
we how do we take good care of the people who are trusting us and being employed by us, and at the same time not spend the entire net income on this healthcare benefit? And it really is. I think just going down the wrong path with the expenses of this, and there is going to be a time when employers are just not going to be able to afford
Mhm.
to do this for their
Correct.
employees unless we change the system. So, that's what we're hoping to do is, honestly, even if Next Level Prime doesn't turn out to be the answer, I want it to move the conversation along because someone has to say, wow, these guys are doing it. They're able to provide this care. They're able to provide it at a different price point than we've seen out there. And they're open 7 days a week. Holy cow.
Mhm.
Maybe there's
Something new.
another way, and so that's what we're here for.
Uh, Tell me what's next.
Yeah. Well, so we're really excited about a lot of new clients that have come on, and right now we're about to. Well, we just launched our mobile app, which is
Mhm.
really neat, and
I've seen that, I know.
we're already doing version 2 of that, so that's going to be even better. We are also in the process of finalizing and launching in December a proprietary platform that we're putting on top of our EMR so that our team has an opportunity to collaborate in the record and to ensure that we're hitting all of the important um, care milestones for all the different chronic diseases. We don't think there's an EMR out there that's really made for the kind of care that we're trying to provide, because there's not a lot that pulls in mental health and health coaching and the navigation piece and puts it all together in an electronic medical record. So we're actually working on doing that within our practice.
That is so exciting.
I know it is. It is really exciting. I know the thing is it's going slower than I wanted it to go. I want everything to be done yesterday. And so, but it's a big undertaking. There's a lot to consider, and I think we'll be working on it for a long time, but we're going to get version 1 out the door. So at least we can figure out what's wrong.
Yes.
And,
Yes.
so
And what's right.
and what's right and what's right. And so we're going to do that. And then, the 2024, we're excited to continue our growth. And, I mean, to be quite honest with you, we are going to grow as much as we have people interested in what we're doing and want to join Prime, because we are a private company. We're not public. We're not owned by private equity. We're not managed by a corporation. We are physician run, and largely physician owned. And so, we have a different, I think, path than a lot of the companies that are out there.
I have a very specific opinion about PE and healthcare, and I'll be happy to share that with anybody not on LinkedIn Live. But I think I know we've had a lot of legislation about how physicians should not own their own facilities, and they should not refer to labs they own, or imaging facilities they own, or outpatient facilities they own. And on the one hand, I can understand the impetus for that, but I think when you don't have that connection, you have an opportunity to add a lot of layers, which makes it unaffordable for a lot of people. And I think that's a side effect nobody figured out until 15 years later.
That's right. That's right. I mean, here's the thing is that when the business is primarily existing to further healthcare and treat patients, it is a very different business model than a business that is solely in business to make money. And I'm not saying I don't want to lose money, and I'm not a charity, but I don't need to like squeeze the last penny out of everything. And because of that, we staff our clinics appropriately. Sometimes they're even overstaffed, because we don't want to be understaffed, because that actually affects patient care. Decisions we make, a business person would throw up all over some of the business decisions I've made, but I've made them because it is very important to be that the first and foremost that the patient experience is a great experience. So our net promoter scores will prove that out. We are in world-class range above 90s for our net promoter.
And I want to circle back on that, because you are not a charity and you are a for-profit entity.
We are.
Your monthly fee structure is very affordable, yet you are a profitable entity.
Yes.
And you're quite clear about that. And I think we need to have more conversation about that and how that works.
Yeah.
You don't have to refer out. You don't have to send so many people for imaging, complex imaging. You don't have to send so many people for this, that, or the other. Your providers can act as they wish to act.
Right.
Incredibly important.
Well, it is. And I will say that, I mean, I have a lot of friends that own and run hospitals, and I think hospitals are extremely important. One thing, though, that has been a detriment to healthcare is that, hospitals decided that they needed to start owning all these doctors. And when a physician practices in a relationship where their employer is a large hospital, whether they're not for profit or for profit, it doesn't matter. They really want them to use their very expensive advanced imaging and their very expensive facilities. Wow. And I mean, lab is insane. If you look at the lab markup in a hospital situation, it is, 60 to 100 times more than the cost of the lab. And so if you just kind of like stand back and go, oh my gosh, that those are the things that are out there and happening. And it's not anyone's fault in particular. The doctors moved into hospitals because they didn't feel like they had any negotiating power. Mm-hmm. The hospitals could do better for them in as an employee than they could do on their own. And so that shift has been made. We had to it's very hard to be independent, and
Yes.
it's very difficult to get. That's why we had to be kind of come out with a splash. And some people might have thought I was crazy because the first year we put up 9 clinics, and that is a little bit, you know, gutsy, but we did that because we needed to look like a big organization. Otherwise, we would just be,
Alive.
yeah.
Yes. And I want to go back to those lab costs, because I was reviewing claims for a client of mine, and these were before they were a client from their previous vendor. And there is a hospital facility in San Antonio that was paid $1,690.97 for complete metabolic panels.
God.
And I was like, and we don't do that we don't do the analysis. We simply don't have the claim bank. We have a service that does that.
Just for your viewers' knowledge, that's a $6 cost.
Test. Yes, it's a $6 test. And I about jumped out of the skin. I got the report, and the guy that ran the report called me and said, "You sent me the wrong data." I said, "I didn't send you the wrong data." He said, "This is impossible." I said, "Nope."
We love to show clients how much we're saving them on lab.
Carrier average for that test is $83 for those of you that are listening, right? So a $6 test turns into an $83 bill. And that's a little much to me.
Yeah.
So you're headed into North Texas, I understand.
We would love to be. So, I mean, honestly, I've got big aspirations for this company. I hope that people continue to love Prime, and we continue to grow. We've doubled in our customer base from last year to this year. We're expecting to do that again next year, at least. We have our eyes on Dallas-Fort Worth area as our next big area that we would like to be in. But again, like I said, we need to be cautious because we don't have any big money backers.
Yep.
So we have to make sure that we have a solid footing in San Antonio and Austin before we move on to our next region. But we're really excited. We love being a Texas company right now. We've been it's been great. So.
Well, I think we'll leave it there. Thank you very much for joining me. I really appreciate you taking the time. And I think that it is very important to understand and show that healthcare can be a profitable business, but it doesn't have to be that profitable a business.
Yeah. Well, it's been a pleasure to talk to you. Thank you so much for having me, Allison. It was a fun conversation.
I'm glad you joined us. And for those of you that are listening, give us a like, and we will see you next time.
We hope you've enjoyed this episode. Raising the Bar is powered by Altique Consulting, the country's leading independent expert in healthcare cost containment. Astute employers know there's a better way to offer health insurance, and we help them achieve it.